The surgery itself is you're sedated, so you don't feel anything, obviously, um, but and you're on pain meds when you come out, and the surgery itself, and I had studied on the website, the manufacturer of the knee. I'd studied the surgery and looked at it and knew what it was going to be about, and it's about a 2.5 hour surgery, and so I knew it was going to be pretty straightforward. The work comes after the surgery because, as you well know, the knee is the most complex joint in the body, lots of nerves, tendons, etc. And so the rehab was a lot of work. And if I could say anything, that's the surgery was piece of cake on both knees. Very good surgical team, very good hospital care, um, and I'll stop there. Well, here's the good news. There's nothing I cannot do, um, and I'm just elated uh, as to the healing, and I'm in no pain. I'm not on any medication, and I can. It's probably unusual for most knee patients to say this, but I can kneel on both knees, and with very little effort and no pain. I don't do a lot of it. I'm very respectful of the things that I lift. I try to lift smart. If I'm lifting something heavy, I use a wheelbarrow or a dolly, so I lift smart. And I try to respect them for what they are. But I can, on the ranch that I live on, I build fence, I dig ditches, I do concrete work, I do just a number of things, cleaning pens with no pain. I really would. I wish I hadn't been so fearful of the surgery in the first place. I probably wouldn't have lived those 4 or 5 years in that level of pain that I described to you. Had I known that it would just be this easy. And so I definitely, anybody that's looking to have knee replacement surgery, I highly recommend that they get to a reputable surgeon like Dr. Jamali and get an opinion and get the surgery done. There's various medical conditions with each patient is different, I'm sure, but I'd highly recommend the surgery. I think the best part of the experience was the professional staff at Dr. Jamali's office and Dr. Jamali himself. I think the the level of the surgery expertise that he has, the skill level that he has, and all the doctors in the operating theater. There's a team. We're all very highly skilled and highly professional. They know coming out of the operation, he comes by your room, he sees you, and what I like about him is he's not your usual doctor. He's really easygoing. He's very professional, but he treats you like a real person, and that's really, I have the highest regard for him because of that. He makes the whole procedure very easy. He tells you what to do. This is the key, I think, to a swift and wholesome recovery is the amount of effort that the patient puts into the rehab operation, the rehab period of time. Pedal to the metal. I was doing 5 days a week, and I think you get out of it what you put into it. And obviously, I pedal to the metal, and I've got some really good movement out of both knees and no pain. I would certainly, if I had it to do over, I'd do it again.